Good morning students. Today we will discuss the ophthalmic nerve. This ophthalmic nerve is a branch of trigeminal nerve which we have discussed in our previous lecture. I told you in my previous lecture that trigeminal is a mixed nerve. Out of this, the three branches of the trigeminal, the ophthalmic and maxillary, these are purely sensory nerves, and mandibular nerve is a mixed nerve. Now today we will discuss the ophthalmic nerve. Now this ophthalmic nerve, as I have told you, is coming from the trigeminal nerve which bears a ganglion. So it is just arising from the anteromedial portion of the trigeminal ganglion. So what is important regarding the description of any nerve is, I told you in my previous lectures that what is the type of nerve, that is ophthalmic nerve is the sensory nerve, purely sensory nerve. Now what is the course of that nerve starting from its origin to its distribution, that is the different branches which are arising from that particular nerve. So that is important. Now what is the course of this nerve? Now this nerve is arising from the anteromedial portion of the trigeminal ganglion, that is anteromedial portion of the trigeminal ganglion. After that it pierces the dura mater, and enter the lateral wall of cavernous sinus. And in this, it divides into three branches, that is lacrimal. This is the lacrimal nerve, you can see. Then second is the frontal. This is the frontal nerve. And third is the nasociliary. So this is the nasociliary nerve. So these are the three branches which are arising from this nerve. And these three branches, they pass through superior orbital fissure. And enter into the orbit. So this is the course of this nerve. Now coming to the different branches of this nerve. So we will discuss the branches in detail. First is the lacrimal nerve. First is the lacrimal nerve. What is the fate of lacrimal nerve? So third part is its branches. Now this lacrimal nerve is running along the lateral wall of the orbit, and it just receive a communicating branch from that is zygomaticotemporal nerve, which is a branch of zygomatic nerve, which in turn is a branch of maxillary nerve, and maxillary nerve is in turn a branch of trigeminal nerve. So it has a communicating branch, that is zygomaticotemporal nerve, and it supplies the lacrimal gland. So this is the fate of this nerve. Now second is the frontal nerve. Now this is the frontal nerve. Now this frontal nerve is running between the periosteum of the orbit and levator palpebrae superioris. It is running forward and is dividing into two divisions, that is supraorbital and supratrochlear. You can see in the diagram. So this is the supraorbital, this is the supratrochlear. Supratrochlear is the medial one, and this is the supraorbital. Now this supraorbital, it divides into medial and lateral branches. Medial and lateral branches. So as this nerve is passing through this, that is you can see here that supraorbital foramen is there, or supraorbital notch is there. This nerve is running upward. So the distribution of this nerve is up to the lambdoid suture of the scalp. So this reason. So what is important regarding this, the clinical aspect of this nerve is in frontal air sinusitis. So what is happening, the referred pain is felt in this whole of the head up to the lambdoid suture. So this is because of its distribution of the frontal division that is coming from the ophthalmic nerve. Now what are the other areas which are supplied by this nerve? That is upper eyelid, then conjunctiva, then frontal air sinus, then comes the scalp up to the lambdoid suture. So these are the important structures which are supplied by this supraorbital nerve. So I repeat, supraorbital nerve, it supplies the upper eyelid, conjunctiva, then the frontal air sinus, which is very important clinically, then third is the area of scalp up to the lambdoid suture. So because of its relation, that nerve which is supplying the frontal air sinus, so that nerve is arising from supraorbital nerve, and the nerve which is going to supply the scalp up to the lambda suture, again it is getting origin from the supraorbital nerve. So this relation is important. So why the in frontal sinusitis the headache is felt up to this region, that is lambda region. So rapid pain is felt over here because of the common nerve supply. Now coming to the supratrochlear nerve. Now this supratrochlear nerve, it leaves the orbit from the medial edge of this. It supplies the medial and lower part of this, and you can see here that it has a communication with the infratrochlear nerve here. So this supratrochlear nerve has a communication with infratrochlear nerve, which is a branch of nasociliary nerve. So this is the fate of supratrochlear. So what is the area supplied by supratrochlear is that upper eyelid, conjunctiva. So, and third important thing regarding this nerve is that it has a communication with the infratrochlear nerve. Now third is nasociliary. Now this nasociliary nerve, you can see once it is arising from the ophthalmic nerve, it is just crossing the optic nerve and it is just going medial to this. Now coming here and ending into two branches, that is infratrochlear and anterior ethmoidal nerve. So before that it gives some branches. One is it has a connection with the ciliary ganglion. Then it gives the long ciliary nerve. So these are the long ciliary nerves which are running and piercing the sclera, going to supply the choroid body, iris and you can say cornea. Then this portion, this is the region, that is this portion. So that is ciliary ganglion has a short ciliary nerve which are going to supply the choroid body, iris and cornea. So this is piercing the sclera and reaching up to this. So it is just receiving the sensory fibers from these structures. So these things. Then second important relation of this long ciliary nerve or nasociliary nerve is that it is going to supply the dilator pupillae muscle, that is post-ganglionic sympathetic fibers to the dilator pupillae. So this is the another root of that nerve. Then comes the posterior ethmoidal nerve. Now this posterior ethmoidal nerve, it just passed through the posterior ethmoidal foramen which is present in the lateral wall of the orbit, and it supplies the ethmoidal air sinuses and sphenoidal air sinuses. So that is important. Then comes the anterior ethmoidal nerve. Now this anterior ethmoidal nerve has some, you can say, different course. It is not going to supply the structures which are lying within the orbit. So what is the fate of that? The anterior ethmoidal foramen is present in the lateral wall of the orbit. Now once this nerve is arising from the nasociliary nerve, it pierces that anterior ethmoidal or enters into the anterior ethmoidal foramen and reaches where? Into the anterior cranial fossa. So in which region? That is in the region of cribriform plate, that is in the central portion of the anterior cranial fossa. So it is just entering into that fossa and running on the cribriform plate, and on either side of crista galli, which is present, which is the part of the anterior cranial fossa, this nerve again dip downward. So once it is entering into that foramen, it opens into the nose. So in the nose, it supplies the lateral wall as well as nasal septum. Clear? So this is somehow different course of you can say anterior ethmoidal nerve, as the posterior ethmoidal nerve is just passing through the posterior ethmoidal foramen and supplies the two sinuses, that is ethmoidal and sphenoidal air sinus. But in anterior ethmoidal nerve, it re-enter the cranium. It is re-entering into the cranium, where? Into the anterior cranial fossa, running on the surface of cribriform plate. On either side of the crista galli, it again dip downward, and that foramen is communicating with the nasal cavity. So in the roof of nasal cavity, it enters into the nasal cavity, so where it supplies the lateral wall and nasal septum. So in the nasal cavity, it gives two branches, that is internal nasal nerve, as I have told you, which is going to supply the nasal septum and lateral wall of nasal cavity, and after that it just leave the nasal cavity at this level where the cartilage and bony component, they are just joining. So it come as an external nasal nerve and it supply this region. So external nasal nerve is going to supply the region of the nose. So this is the fate of anterior ethmoidal nerve. Now this is the infratrochlear nerve, you can see here. Now this infratrochlear nerve has a communication with the supratrochlear nerve, and it is just giving the branches to the lower eyelid and related conjunctiva. So this is all about the ophthalmic nerve. So what is important at your level is you should know what type of nerve it is, that is sensory. Then how it is starting, that is from the trigeminal ganglion. So after that it enters into cavernous sinus, where it gives three important divisions, that is lacrimal, frontal and nasociliary. So what is important regarding lacrimal nerve is it is going to supply ultimately supply to the lacrimal gland. So that basically fibers are reaching to that portion. Now, then is the frontal nerve. This frontal nerve is going to give two important branches, that is supraorbital and supratrochlear. Then nasociliary. Nasociliary has communication with the ciliary ganglion, that we will discuss in different lecture. So it is through short ciliary nerve, it is just supplying the ciliary body, iris and cornea. So it is receiving the sensations, sensory supply from these structures, and they reach the nasociliary nerve to reach the higher center. Then is long ciliary nerve. So these long ciliary nerve is basically piercing the sclera and reaching to the anterior portion of the eyeball. So in the interior portion of the eyeball, it is going to, you can say, getting the sensations from the cornea, iris, and they are entering into the nasociliary nerve. Now after that it gives one branch, that is posterior ethmoidal nerve, which is concerned with the two important sinuses, that is ethmoidal and sphenoidal ear sinuses. Then is anterior ethmoidal nerve, which is basically going to supply the nasal cavity, that is nasal septum and lateral wall of the nose. The course I have told you, that it re-enter the cranium then leave it again. So this is all about the ophthalmic nerve. I hope you must have understanding of this. So if you like my channel, I again request you to kindly subscribe it.